years old man present to the emergency department with 2 days history of the swollen painful left knee. That means the 2 days history and there is swollen and painful left knee. You aspirate the joint to avoid admission to the orthopedic ward. And aspirated fluid, it shows the calcium pyrophosphate crystals. Which of the following blood test is most useful to revealing the underlying cause? So a patient presents for the swollen and painful left knee, but you aspirate, and the aspiration there is present calcium pyrophosphate crystal, which is a important crystal. So now you want to do blood test. So to the favor in diagnosis of this condition, what blood test you should do? Here the options are transferritin saturation, ACTAs, ANA, serum ferritin, and LDAs. So first of all, let's see the pseudo gout. In case of pseudo gout, it is a form of microcystical. In this, synovitis caused by the deposition of calcium pyrophosphate dehydrate. So the joint aspirate, we saw that there is a calcium pyrophosphate dehydrate present in the joint fluid. So it is the diagnosis is the pseudo gout. So it is the in favor of the pseudo gout. But what are the risk factors? Here are some important risk factors of the pseudo gout, including the hyperparathyroidism, hypothyroidism, hemochromatosis, acromegaly, low magnesium, low phosphate, and Wilson's disease. So they are the risk factor. That means some important pathological condition, they are the risk factor for the pseudo gout. And the calcium pyrophosphate dihydrate, they are present or they are found in the joint fluid in case of the pseudo gout. Gout is different from the pseudo gout. So this is the pseudo gout, and pseudo gout usually it affects the big toe. What are the features? The features, the knee joint, wrist joint, or shoulder joint are commonly affected, and most important symptom is the pain. And when there is the joint aspiration occurs, then the what occur? Calcium pyrophosphate present, and it is weakly positive bifringent rhomboid shape crystal. So this is important, and this crystal shape is bifringent rhomboid shape. So the calcium pyrophosphate crystal, it's looking like bifringent rhomboid shaped. And in X-ray, what change occurs? In X-ray, there is a chondrocalcinosis develop. What is the management? The management is the aspiration of joint fluid to, actually it's for diagnosis to exclude the septic arthritis. NSAID is given usually, but intraarticular, intramuscular, or oral steroid as per gout. That means with NSAID, steroid also use. So one of the option is the NSAID, and second one is the steroid. But first of all, we have to differentiate the diagnosis from the septic arthritis by aspiration of the joint fluid and examination of the lab investigation of the joint fluid. But clinically, as there is no high fever, so we can exclude the septic arthritis, but we have to document the exclusion of the septic arthritis. Now see the elevated transferritin. It is an important acute phase protein. So the transferritin saturation may indicate hemochromatosis or pseudo gout. So what we can do in the blood transferritin indicates it may be pseudo gout, it may be hemochromatosis. And high ferritin level also, that means the high ferritin also present in case of the hemochromatosis, but it can raise a variety of the infections such as the inflammatory process, including the pseudo gout, and part of acute phase response, and varieties of condition where there is a chance of increase the ferritin level, including the virus bacterial infection, such as in the corona period there is the huge measurement of the ferritin level. Invariably almost all patients measured serum ferritin level to see the acute inflammation, but the transferritin, it is specific for the pseudo gout and hemochromatosis. So we should go for the transferritin. Here we can see the calcium pyrophosphate dihydrate crystal. Here showing the rod shape and rhomboid shape, in this slide. Here we can see this is the rod shape, this is rhomboid shape, this type of shape. So what we should go for, as we suspecting the calcium pyrophosphate crystal is present and we are suspecting for pseudogout due to hemochromatosis, we should go for the transferritin saturation, not the other conditions such as the serum ferritin, because the serum ferritin may be increased the different cause in our body, including the bacterial infection, viral infection, or any other acute inflammatory condition.